continuing the lesion scores topic, there are some species that don't show clear lesions, as 𝘰𝘪𝘮 praecox and 𝘰𝘪𝑚𝑖𝑡𝑖s. So how to monitor these 𝘰𝘪𝑚𝑖𝑑s?
It's really difficult. I think we don't have tools for 𝘰𝘪𝑚𝑖𝑑s praecox and 𝘰𝘪𝑚 but we hopefully these two species are considered as the less pathogenic species. However, we worked with 𝘰𝘪𝑚 praecox, and 𝘰𝘪𝑚 praecox is not able to induce clinical coccidiosis in our experience. We made some very strong infection, and we never get clinical infections with clinical signs, diarrhea, like that. But it will have an impact on feed conversion ratio and growth. And when it's associated with 𝘰𝘪𝘮𝘰𝘪𝘮 acervioline, for example, it will increase the pathogenicity of 𝘰𝘪𝘮 acervioline. Concerning 𝘰𝘪𝘮𝑚, the same Ray Williams made some studies, and in some field isolates, he could see that this species sometimes is as pathogenic as 𝘰𝘪𝘮𝑚 acervioline, or sometimes more pathogenic. But these two species do not cause some typical lesions. It doesn't mean that they do not cause lesions. Sometimes with 𝘰𝘪𝘮 praecox, you may have a white exudate on the mucosa of the duodenum. Sometimes you may have some petechia. And with 𝘰𝘪𝘮𝑚, it's the same. You may find some petechia, or sometimes you don't find anything. But there is no link between the intensity of the lesions with this species and the impact they may have on the birds. So with this species, we don't have the tools to know if they are present and to know if they have an impact, because there is no scale to evaluate the role they play. The only way to detect them, maybe it's to make some mucosal scraping in order to see, for example, 𝘰𝘪𝘮 praecox, they have some oocysts of medium size, which look like 𝘰𝘪𝘮 tenella, but it develops only in the duodenum. So if you make some scrapings and you find in the duodenum and you find some oocysts that look like 𝘰𝘪𝘮 tenella in the duodenum, you may suspect the presence of 𝘰𝘪𝘮 praecox. Concerning 𝘰𝘪𝘮𝑚, the only way to show it is present is to look for the very small oocysts, the small rounded oocysts, but sometimes the size of 𝘰𝘪𝘮𝑚 is a bit less than 𝘰𝘪𝘮 acervioline, and they are rounded as 𝘰𝘪𝘮 acervioline. They are ovoid in shape. But if you look at acervioline from the side, okay, it's ovoid. But if you look from the front, then it looks rounded, and you can make the confusion between 𝘰𝘪𝘮 acervioline and mitis. We don't know, as there is not big tool to identify them. We even don't know the prevalence of these species. We don't know if they are frequent or not, and we don't see, we can't know if they have an impact and if they are important to control or not. But as we don't know, I think it should be important to control them, because we don't know.
True. Okay, thank you.